Hi, this is Mrs. Houck. We're going to review ABGs and talk a little bit about compensation today. You've been going over ABG analysis previously in your classes. Now we're going to add the concept of compensation. No compensation, partial compensation, and full compensation. I have posted a website on YouTube. It's called ABG Tic-Tac-Toe. It's about 15 minutes in length, and it's very good at helping practice and learn the difference between partial and fully compensated ABGs. The concept can be a little confusing. I encourage you to look at this YouTube website as well as this PowerPoint before coming to class so we can review a few problems and make sure that you're all on the same page. Just a quick review, acidosis versus alkalosis. Your normal pH range is 7.35 to 7.45. The acidotic being less than 7.35, the alkalotic side being greater than 7.45. Your normal PCO2 is 35 to 45, and your normal HCO3 or bicarbonate is 22 to 26. The asterisk indicates that depending on a facility or lab manual that you look at, that value may differ 1 point one way or the other, but this is the general range that you should remember. Acidosis to alkalosis continuum, the middle point of that is the value of 7.40. You'll see down the left side your acidotic values, your pH, your CO2, and your bicarbonate. On the right-hand side, you'll see the alkalotic values. When you're interpreting an ABG and your ABG is compensated, your pH will be normal. How to tell whether you're in acidosis or alkalosis is to look at which side of the 7.40 value your pH falls. Because when you're compensating, the pH will never go past that middle point. If it's acidotic, it will never come higher than 7.40. If it's alkalotic, it will never come lower than 7.40. Compensation. An uncompensated ABG, your pH remains abnormal. The value, meaning the CO2 or the bicarb, not matching the pH. Not matching as in acidosis or alkalosis, remains normal. And when we go over some examples, this will make more sense. Partially compensated, the pH is still not normal. However, the value not matching the pH in acidosis or alkalosis is abnormal. Compensated, the pH is normal, and the value not matching the pH in acidosis or alkalosis is abnormal. The pulmonary and renal systems are what compensate for one another. The system not causing the problem will try to compensate by returning the ratio of bicarbonate to acid to normal in the body. The lungs compensate for metabolic disturbances by changing carbon dioxide excretion, and the kidneys compensate for respiratory disturbances by altering bicarbonate retention and hydrogen ion secretion. It's important to know the background about compensation to help you understand how to analyze your ABG. Be an uncompensated ABG. Let's look at the pH. It's 7.49. It is definitely alkalotic and not within the normal range. Our PaCO2 is 40, and that is perfectly normal. It falls in the 35 to 45 normal range. Our bicarbonate is 38, which we know is high and falls in the alkalotic. The bicarbonate matches the pH in alkalosis. They're both alkalosis. It's metabolic alkalosis. The value not matching the pH, the PCO2, is what's going to compensate for that abnormal bicarbonate. So the lungs are going to compensate for the kidneys. However, it is a normal value. The lungs have not started to compensate for this metabolic alkalosis. Compensation, we have our abnormal pH. It's 7.29, and it's on the acidotic of abnormal. Our PaCO2 is 32, which we know is abnormal, it's low, it's outside the range of 35 to 45, and it's alkalotic. Our bicarb, our HCO3, is 15. It's low on the acidotic side. It matches the pH. They are both acidotic. So the value not matching the pH is the CO2, and that is the value that is going to be the compensator. Why this is partially compensated is because the CO2 is abnormal. The lungs are trying to compensate for the metabolic acidosis, but it has not compensated enough to make the pH normal as of yet. This is a partially compensated ABG. Compensated, meaning our pH is normal now. It is 7.35. Our PaCO2 is 55, which is acidotic for a CO2 level, and our bicarbonate is 33, which is high, which is alkalotic. Now, you're saying our pH is normal, so how do we know if it's acidotic or alkalotic? Because which side of the 7.40 value does it fall? It falls lower than 7.40, meaning it is acidotic, even though it is still in the normal range. Our value matching that is our CO2, so we have a respiratory acidosis. The bicarb is abnormal because the kidneys are trying to compensate for this respiratory acidosis. That's why the value is abnormal, and it has compensated enough to bring our pH just to within normal range. This is a fully compensated ABG. Let's take this example. Throw in the PaO2 because typically on tests or on NCLEX, they'll throw in the O2 level in an ABG and sometimes an oxygen saturation value. My suggestion to you is to immediately, unless the question is asking about oxygenation, cross those out. They mean nothing in acid-base analysis. It is just a distractor. So we're going to focus on our pH, our PaCO2, and our HCO3. Our pH is 7.17. We know that this is low. This is an acidotic pH. Our CO2 is 62. This is high. This is an acidotic CO2 level. Our bicarb, HCO3, is 22. This is still a normal value. So since the CO2 matches the pH in acidosis, this is a respiratory acidosis. The bicarbonate is what needs to compensate to make our pH normal now. However, it is not abnormal. It is still a normal value. So this is an uncompensated respiratory acidosis. Next, ABG. Our pH is normal. It's 7.42. Our CO2 is 21. It is low. It is alkalotic. Our bicarbonate is 13. It is also low, but it is acidotic. So we need to say to ourselves, our pH is normal. So this is a compensated ABG, but how do we know if it was acidotic or alkalosis to begin with? Which side of the 7.40 value does it fall? It falls on the alkalosis side. So we now know that we had an alkalosis. So which value matches that in alkalosis? The CO2 is also alkalosis. So we have a respiratory alkalosis. The bicarb is acidotic, and the kidneys are what are trying to compensate for our respiratory alkalosis. So this is a fully compensated respiratory alkalosis. There's a couple more ABGs here. I'm going to show them to you, let you try to figure them out, and then we will go over them in class. encourage you to also watch the ABG tic-tac-toe to help you figure out your analysis of those ABGs. Just really quickly, I'm going to review treatment. A treatment of respiratory alkalosis, this is the easiest to treat. You do it by having the patient rebreathe. Either give them a paper bag, put them on a non-rebreather mask. Once the patient rebreathes enough CO2, the respiratory rate will slow. They're breathing off too much CO2, and you need to have them retain some. If your patient is on a ventilator and their ventilation's being more controlled, you can decrease the rate of the ventilator, the tidal volume, or give the patient sedation to slow their breathing. Of metabolic alkalosis, this is the most difficult to correct. You have to wait for the bicarb to decrease on its own. The kidneys take a lot longer to return to normal than the lungs do to normalize. There is a drug called Diamox. It's a diuretic that causes the excretion of bicarbonate ions, and it may be used if the alkalosis is severe enough. Of respiratory acidosis, you are retaining too much CO2. You need to decrease the use of sedation or narcotics, stimulate the patient to awaken them, give them a respiratory treatment, put them on BiPAP, do something so they're exchanging their carbon dioxide more frequently, taking bigger breaths. If they're on a ventilator, you can increase their respiratory rate or tidal volume to have them do this. Finally, treatment of metabolic acidosis. The only situation where sodium bicarbonate should be given IV. It's given IV and it's given in small amounts to prevent pushing the patient into a metabolic alkalosis. They will give some sodium bicarbonate and then they will recheck ABG values to see, because it works very quickly, to see how it's corrected before they give more. Sometimes if patients are sick, they will put them on a sodium bicarbonate drip and check frequent labs. All right, if you have any questions, please write them down, bring them to class, and we'll go over them. Thank you.